But unlike USMLE Step 1 and Step 2 CK, it can only be taken in the USA. It cannot be taken outside the USA. It cannot be taken in Pakistan. Now, it tests your advanced clinical patient diagnosis and management skills. So it's an advanced form of USMLE Step 2 CK. Your USMLE Step 2 CK knowledge helps you a lot in USMLE Step 3. Again, it's an optional exam. It can be taken before your residency, before the start of your residency, or it can be taken during your residency. Now, why should you take your Step 3 before residency? Now, the benefit of taking Step 3 before your residency is that you are then eligible for an H-1B visa. Now, H-1B visa is a work visa. It's a higher form of work visa. I will talk about H-1B visa later on, and what is the benefit of H-1B over J-1 visa, which is another form of work visa. Now, getting a high score on USMLE Step 3, which is usually above 85, increases your chances of getting a residency. Because by getting high score in USMLE Step 3, you are saying to the program directors that I have a very good clinical knowledge, I have good understanding of how to manage the patient, even the complicated patients. So it increases your chances of getting a residency. Now, what should be the method of study for Step 1, Step 2 CK or the Step 3 exam? Since these three are the MCQs based exams. So you should have a strategy to study for these exams. Now, there are two things for this. Now, I believe your strategy should be like this. The number one thing is the knowledge database. The second thing is the MCQ solving ability. Now, what is this knowledge database? You increase or improve your knowledge database by studying books, by getting the theoretical knowledge, by studying the lecture notes, and by watching video lectures, and by getting teaching classes. It is increasing your theoretical knowledge. Now, the best source for knowledge database acquisition is Kaplan lecture notes and Kaplan videos and our academy. The best method of gaining database is read before watching the Kaplan video lectures or before coming to the academy for getting the teaching class. You should read that topic or chapter beforehand through lecture notes, Kaplan lecture notes. Number second thing is repeat. By watching the video lectures or by coming to the academy and listening to your teacher, you will be repeating the same knowledge that you've read already in your lecture notes. Now, by coming to the academy, if you have any questions while reading your lecture books, they will be answered. And also we will be revising the knowledge that you read and also making it more simple and adding more things in it. The number 3 is the revision or the revise. Revise the material at home. So basically you are doing 3 readings. You are reading the lecture books before you came to the academy. Number 2 is the repeat by video lectures or by getting taught. And number 3, third reading is your revision. Never appear in the exam without revising your knowledge. Now, the second thing is the MCQ solving ability. Now, since Step 1, Step 2 CK and Step 3 is an MCQ based exam, so you should be comfortable while solving the MCQs. Now, you can improve your MCQ solving ability by doing a maximum number of practice MCQs. So that when you appear for the exam, you are very easy while doing with the MCQs. Now, what are the sources of MCQs? Where can you find these practice MCQs? USMLE World, which I believe is the best source for the MCQs, the Kaplan Q Bank, the First Aid Q Bank, and the Kaplan Q Book. Now Kaplan Q Bank and Q Book are different. These are different MCQ pools. Now what should be the method of MCQs? How should you do the MCQs? First, do subject-based MCQs. Like you have done one subject, you have finished physiology. You should, after getting the knowledge database for the physiology, you should do the MCQs of physiology. But once you move on and you have done 7 subjects for USMLE step 1, then you should do the random MCQs. First, you should do the MCQs without any time limit. But once you have done all the subjects, you should do the MCQs with the time limit. Now this is a graph to show how you should plan to get both these things. Now initially, when you start your preparation, you are right here. You should try to achieve as much knowledge database as possible by reading the lecture notes, by coming to the academy, or by watching the Kaplan video lectures. You should achieve this knowledge database. But once you move in time, you should start doing the MCQs. And before appearing in the exam, you should be doing maximum number of MCQs, but you should not be studying the lecture notes that much, because you should have finished those well ahead of time. So before going to the exam,